We are going to examine and study in detail a ear case. The cases that you generally get is a safe ear. What do you mean by a safe ear? It is a chronic suppurative otitis media of the tubotympanic variety. In this, there is a central perforation. A central perforation is one which is surrounded on all sides by a remnant of tympanic membrane. Here, the annulus is intact. When the annulus is intact, it prevents the inward migration of outer canal skin epithelium, which, when it gains entry into the middle ear, becomes what we call skin in the wrong place, also called cholesteatoma. An intact annulus in a safe ear prevents this inward migration, and therefore, in such cases, we do not get the development of cholesteatoma. Cholesteatoma can lead to life-threatening complications, and since this does not occur in a central perforation, we call it a safe ear. Here you see a chronic suppurative otitis media of the tubotympanic variety with a central perforation. Here, the perforation is surrounded on all sides by a remnant of the tympanic membrane. In this case, the annulus is intact, as a consequence of which the outer epithelium cannot migrate into the middle ear, wherein which a cholesteatoma cannot develop. This, therefore, we call it a safe ear, since life-threatening complications will not occur. How do we work up a ear case? The workup of a ear case involves, number one, examination under microscope and studying the case in detail. If there is pus, then it is sent for culture sensitivity. If the ear is dry, we perform what is called a patch test. An aluminium foil is placed on the eardrum, and if the patient regains hearing, it means the ossicular chain and the rest of the sound conducting mechanism is intact. We will perform a pure tone audiogram to find out the level of hearing loss and whether the neural component is intact. We will take a mastoid X-ray and find out whether is the mastoid ASL diseased or not. What is the treatment for an inactive, dry, safe ear? A CSOM tubotympanic variety is considered to be inactive when there is no active discharge. In such a case, the treatment involves, number one, if a patch test shows adequate hearing recovery, and if the audiogram shows adequate cochlear reserve, meaning that there is no sensorineural component, then the treatment is myringoplasty. However, if the patch test shows inadequate hearing recovery, wherein there is an ossicular disruption, if the hearing loss is more than 40 decibels, then it means that the middle ear conducting mechanism is disrupted. These patients require an ossicular reconstruction with. What are the types of myringoplasty you know of? The types of myringoplasty that we know are, number one, an onlay, 2, underlay, and 3, an interlay technique.